Monica Akri and Ifra Aiden read news articles, so you don't have to. What's news in healthcare today? Let Monica and Ifra break it down for you.
We are with Healthcare for All Minnesota, and today we are talking about healthcare in the news.
Okay, so you know how sometimes it feels like everyone is writing to Washington to defend a certain policy? Well, what if most of those people didn't actually write those letters? This March 2026 article digs into exactly that. It's called The Insurance Industry's Old Trick, Flooding the Zone. And today we're reading through it and breaking down what it actually means.
So the article was written by this guy, Wendell Potter, who was actually an industry insider back in the day. He worked for the insurance companies, and so he knows the playbook. And he's telling us the real story behind all of these letters that are pouring into Washington and where they actually come from.
So, this article opens up by discussing how the federal government opened a public comment period on how much to pay private Medicare Advantage insurers next year in 2027. And the proposed rates were much lower than what the industry expected. CMS, the federal agency that runs Medicare, received nearly 47,000 comments on this, which was an all time record. So many came in that a CMS official made a joke saying that this may be another innovation related to AI.
Yeah, not far from the truth. There's an organization that you should probably know about. It's called KFF Health News. They are a nonpartisan organization formerly known as the Kaiser Family Foundation. They found that 82% of the more than 16,400 publicly available comments were identical to a letter that appeared on the website of a secretive advocacy group called Medicare Advantage Majority. That group is dark money, and they are insulated and supported by the insurance companies. So whenever something that challenges the insurance company comes to light or is being litigated, Medicare Advantage Majority springs into action and does these sort of initiatives to spark uh, controversy.
The letter warned that without higher reimbursements, seniors would face higher costs and fewer benefits. Thousands of people signed it thinking they were speaking for themselves, but in reality, they were speaking for the industry.
So, for example, there was this woman in West Virginia. She's 90 years old. She's a widow. She's a cancer survivor. And I'm going to try and say her name without absolutely butchering it. Karina Barnham. I think I did okay. And she said she never submitted any comments to the CMS. Yet, 4 letters appeared online under her name. Branham, who isn't even on Medicare Advantage, was unambiguous about her views. I wouldn't recommend it to nobody. Medicare Advantage Majority claimed, well, she responded to an ad on Facebook. And so they're saying that it was her initiative that generated these emails. But when you speak to Karina, she's not about it.
Yeah, and those insurers, they didn't just stop at fake comments. They also funded research, they launched ads, rounded up signatures, and they met directly with government officials. Groups like the Better Medicare Alliance, which is backed by the nation's largest health insurers, and AHIP, the industry's primary lobbying group, led the charge. And according to Wendell Potter, who we all know is a former insurance industry insider, he said, don't believe for a minute that Medicare Advantage Majority wasn't funded by the industry too. I used to work with Washington propaganda shops to help set up front groups like that.
Indeed, he is a good resource to have so that we actually know what's going on. Now he's on our side, which is a good thing. So the advertising blitz warning against Medicare cuts or cuts to Medicare Advantage, and the coalition was actually launched by the Coalition for Medicare Choices and was funded out of the same offices as AHIP or AHIP, which is an insurance industry organization. The Better Medicare Alliance, also an industry alliance, has membership with United Health, Humana, Aetna, and they ran their own paid media campaigns against these cuts to Medicare Advantage. Were they really concerned about the patients, or were they concerned about themselves and their profits? The group spent over 13.5 million on ads, while another dark money group added another 2 million more. Spend that on healthcare, folks.
Hmm. Yeah, what looked like a nationwide groundswell of concerned seniors was really a carefully coordinated pressure campaign. And the goal was to move tens of billions of our tax dollars to private insurance conglomerates.
This is called astroturfing. It is co-opting one of the most sacred things that small organizations that are organized by citizens use. Grassroots organizing and using citizen voices, one voice, one person. But this is different. It's astroturfing. It's fabricating voices. The term was coined in 1985 by a Texas Senator Lloyd Bentsen. He described a mountain of cards and letters sent to his office demanding support for a bill favorable to the insurance industry. And he, in his folksy voice, said, "A fellow from Texas can tell the difference between grassroots and astroturf," Benson famously said. "This is generated mail."
Many years later, the same game is still being played, but now they have more tools. Now they have AI, Facebook ads, and front groups where they are designed to sound like patient advocates, but really they're not.
Yeah, and they have participated in campaigns for astroturfing.
So that was astroturfing, but the industry had another trick up its sleeve. When Medicare proposed cutting the reimbursement rates, insurance companies got scared and went after the independent agency whose numbers made the strongest case for reform, MedPAC, the Medicare Payment Advisory Commission. Instead of arguing the facts, they tried to undermine the people telling the truth.
Yeah, MedPAC is telling the truth. They're the good guys. They are a nonpartisan congressional advisory body, and they don't have any financial stake in the outcome of Medicare policy. So they seem like a wiser voice to listen to than all of these insurance industry organizations. And MedPAC's January 2026 status report estimated that Medicare Advantage overpayments are projected to be 76 billion, or 14% more above what spending in traditional Medicare would be for the same beneficiaries this year. So they really cut to the heart of the issue. MedPAC called out the insurance industries and their Medicare Advantage scheme.
Yeah, the Wall Street Journal published an op-ed attacking MedPAC's research methods and even called for it to be defunded. Industry-backed groups amplified the attack and pushed legislation to restrict how MedPAC can conduct research. Essentially, they're trying to tie the hands of the independent watchdog. And here's another trick. When government officials leave office, insurance companies offer them lucrative board seats. Their government credentials make them look like trustworthy, bipartisan voices speaking out independently, but they are just getting paid. Take former HHS Secretary Thompson. After leaving government, he joined the board of Centene, one of the largest Medicare Advantage insurers for nearly 2 decades. He then co-wrote an op-ed questioning independent research on Medicare Advantage when none of that was disclosed to the readers.
Yeah, so when we hear about people who have past experience, we automatically think that they are an authority. You know, past legislators, years in Washington. I was on the Health and Human Services Committee. I was in HHS. It is an appeal to authority. Credentialed, sometimes bipartisan voices can be bought after these individuals have served their time in government to be on boards of insurance industries. And these people whose government service we helped buy, you know, with our tax dollars, we were paying them to serve us, now use that experience against us. The messengers look trustworthy. The message sounds reasonable, but you don't see what's behind it. They are getting paid. And Wendell Potter says, I know because I helped write that playbook too.
So what's actually at stake? The Trump administration proposed a rate bump of less than 0.1% for Medicare Advantage plans in 2027, far lower than what insurers wanted. The proposal also included tighter guardrails to curb the tens of billions in overpayments flowing to private insurers every year. The final decision is due any day now.
So the other thing that happens when there's proposed legislation is that industry creates this supposed surge of flooding the zone, astroturfing, whining, and CMS sometimes caves. They look at it and they're like, oh my gosh, we can't change so fast, and it actually works.
Yeah, it's quite common for CMS to cave, not just because of the pressure campaign. The industry does have one more tool, the promise of campaign donations. If they get what they want, expect millions from insurer PACs to flow to Republican congressional candidates later this year. And Potter knows this firsthand. He said, my team and I at Cigna wrote talking points for our lobbyists who sometimes spent as much time in the White House as in the Capitol, and we doled out the company's PAC money to influence elections.
Yeah, they have stacked the stakes against the citizens. The article really pulls back the curtain on how the insurance industry manufactures the appearance of public support to protect their profits. And they have so much more money than we do as citizens. It's an unfair fight. It's like bringing a knife to a gunfight.
Right? It is really unfair. And next time you hear that tens of thousands of Americans wrote to Washington to protect Medicare Advantage, Potter says to ask yourself one question: who wrote that letter?
Viewers, what do you all think? Were you aware that so much of the public input is actually industry driven?
Drop your thoughts in the comments. We really want to know.
Thank you.
Thank you.
And we'll see you on the next edition of Healthcare in the News.